A good cybersecurity strategy helps healthcare organizations define these boundaries between trusted and untrusted territories, including layered checks before deciding who can access what information. Good security practices, a prescription for healthcare. Reduce the attack likelihood. Improve security measures around insecure communications and asset exposures. Prevent outbound and inbound permitted access on a need-to-know basis. Restricting removable media usage adds to limit malware delivery and infection. Segmentation at user, data and network levels would offer classification, control and safeguarding of sensitive data. Ensure secure remote connectivity and perimeter security by patching the exposed systems. Utilizing multi-factor authentication. Employing the least privilege principle and ensuring the use of separate accounts for privileged tasks. Strict user management based on change and approval management processes would ensure accountability for all users. Reduce the attack impact. Isolate compromised endpoints in your network where command and control beacons or other lateral movements have taken place. Restrict access to only those functions that are critical for devices to connect to the primary environment. Network zoning to help reduce the malware infection across the entire estate. Anti-malware capabilities in place offer early warning signs of endpoint infection. A handy incident response plan would help with a timely response to security events. Tactical patch management. Patching should involve assessing and prioritizing vulnerabilities and using defense-in-depth tactics to manage your operational risks. Reduce ways to exploit attacks with secure architecture and configuration. Backup of your business-critical data along with logging and monitoring processes in place. Protecting medical devices. Identify all the devices across the estate that should act as inventory with device information, operating system, IP, location, etc. Create a risk mitigation plan based on reducing the likelihood of an attack and reducing the compromise in case of an attack. Third-party risk management. Third-party security validations provide cybersecurity assurance against your third-party approach. As a base, standard data protection and risk assessment frameworks such as SOC compliance audits are a good start. Like we discussed above, it is important to understand your attack surface exposure before applying the bandage. Just deploying a few devices here and there would only exacerbate the problem. Cybersecurity is an ongoing improvement, and healthcare organizations should ensure a risk-focused prioritized approach to increase the cybersecurity maturity of their estate. Get in touch for a non-salesy chat for your primary security concerns. https://thecyphere.com/